Hi there, I'm Dr. Stephen Phelan. Welcome to this video. Today I'm going to answer another question in my webinar questions answered series. And this webinar is from my Master Your Case Acceptance webinar, where I teach my A to Z system for case acceptance. And this question's from Dr. Damian, who would like to know, Dr. Phelan, please, in general, approximately how long is your initial consultation time? And that's a good question. And really, it goes down to my system being that we see all of the potential new patients that are looking for uh, rehabilitation cases or veneer cases, etc. I see them for a short consultation at the beginning because I just would like to know which way I'm going to manage the patient's case. Because some of these patients, will go right to functional analysis records, so a comprehensive exam, study models, photos, etc. And some of these patients I'm going to want to refer for some form of specialty treatment. So we don't book everybody who calls or inquires online about having veneers or having a rehabilitation completed. We don't book them right in for the restorative records. And the reason is some of these cases I'd rather get some form of specialty treatment completed before I do the restorative records. So I may want to have the patient do orthodontics. It might be very clear that this is an ortho first case. So there's really no point in me doing the full-on restorative records because the orthodontist is going to do records also and can send me digital copies of those. Or I may want to do gingival tissue grafting, for example. So may as well get the periodontist to get this set up properly before I do the full restorative records again. Because for a veneer case where it's clear we want to alter the gingival levels in a couple places with a connective tissue graft, it makes sense to do that before we do the restorative records, the full functional analysis. So the main reason I do these initial consultations is A, do I want to send the patient to a specialist first? And B, to see if the patient's a good fit for my practice. We might have fees that are way too high for the patient. I'm not going to give them a detailed estimate before I've done the diagnostic records because I don't know what the case is going to involve, but I can give them a ballpark. I could tell them that, most of my rehab cases, full mouth rehab cases go for between $60,000 to $80,000, for example. Or I could tell them, a lot of veneer cases similar to yours can go from a fee of $15,000 to $25,000. And at least I know that they know then the ballpark fee that we usually have for a case like theirs. So it's good, again, to establish that it's a good fit. We're a good fit for them. And it also gives me an opportunity to meet the patient and see whether or not they're a good fit for me to treat, because not everybody's a perfect fit to treat in your practice. So, before we go through and spend all the time we do on the functional analysis, the records, the mounting of the case on the articulator, my assistant spends a lot of time just on that. So before we spend all of that time and have the patient incur that fee, I'd like to meet them and know whether or not I'm going to refer them or whether or not they're good to go right to the restorative records, and give them a ballpark of the fees. I won't give them a written estimate of fees because I do not know at that point the exact treatment plan and the fees. I just don't. I don't know if I'm going to equilibrate the patient. I don't know if I need to add any foundational restorations. I haven't seen all the radiographs. I just don't know all the whole picture. So that's why we do this short consultation. And to answer your question, how long is this consultation? I kind of got off on a tangent about the fact that we do this initial consultation, but how long is the initial consultation? Well, that is usually 20 minutes of scheduled time. And sometimes it might take a little longer, and one of my assistants will speak to the patient longer, but my time in my schedule is usually 20 minutes, and that's plenty of time to A, assess if this is a patient that we want to refer or have go right to restorative records, B, give them a ballpark and make sure that they're a good fit for us, or we're a good fit for them, I guess, with that part of it, and then just talk to them for a few minutes and make sure they seem to be a good fit for us before we commit to doing all of the functional analysis. And typically it's a pretty low-key consult. We have it in one of my operatories. And a lot of the time I'll show them one of my photo books. So I have these photo books that I've created. These ones are specifically for my Velocity Elite members, but I use them in my practice. And with the photo book, I basically show them a few similar cases to theirs that I can show in the book, some before and after pictures or some case photos. And it just gives them an idea of what the process is. Just gives them some information. A lot of them have been on my website, these patients, potential patients, so they've seen the kind of work that we do, but this gives them another level of additional information, and that's basically it. If they feel that we're a good fit for them, they'll book the records appointment, or they'll go for the referral that we give them to for either, usually it's one of two things, as I said, either orthodontic referral or periodontic referral. Sometimes I'll send them for a CBCT also as part of just the records that I'll do, because we send that out. We don't do that in-house. I want a radiologist to do the report and all of that. So hopefully that gives you some ideas of our consultation process. So my system is initial consultation, figure out what's going on with the case roughly, whether or not referral to specialist or me actually doing the restorative records. Then we do the restorative records, and then we have a final treatment planning consultation once we have the restorative records, the models mounted on the articulator, and all of the digital photo series plus digital radiography. And then we can get together, have a nice meaningful consultation, and go forward with the treatment. If you'd like to know more about how we structure our consultation, our second final treatment planning consultation, you could attend my Master Your Case Acceptance webinar. It is www.phelandentalseminars.com/MYCA-reg. It's kind of a tongue twister of a name, but I'll put a link below this video to register for that webinar if you're interested in attending. So thank you very much, and we'll talk to you soon. Take care.